Good evening. I'm Dr. Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. Many of you have followed me for the last couple months since I went to New York City during the outbreak then. And then I got sick myself with COVID, but have made close to a full recovery. I'm now doing a weekly video, and I encourage you guys to follow along as I give updates on what's going on with the coronavirus. So today I'm going to go through the numbers, both on a worldwide basis, the United States, and then a little bit more specific about Arizona, because that's where I live. And then I'm going to do a couple of teaching points, one about excess death, and then I'm also going to teach about how death isn't everything and what it's like living long-term with corona. So I'm going to jump into this, and hopefully you'll find this educational. So kind of like I have the last couple of weeks, what I'm going to do is I'm going to go through the data here just looking at my computer, and then I'll attach the photos below if you're following on Facebook or LinkedIn. And then I'll put links to everything I'm talking about as well. I think it'll allow this to go a little quicker and allows me to stay up on these videos. So first of all, I'm on worldometers.info, and just looking at a very high level global look, we have 11 million cases in the world now and 523,000 deaths from COVID-19. If you jump down to a United States view, and I'm going to go over yesterday's numbers because it's almost 5 o'clock Pacific time, and the numbers aren't quite updated for Thursday, July 3rd. So I'm going to go through yesterday's numbers. Yesterday was the first day that we hit over 50,000 cases, with 51,000 cases reported in the United States, and it looks like we're going to beat that number today, but I don't have all the data in yet. What's interesting about yesterday's numbers, if you live in Arizona, is we had almost 5,000 cases, 4,877, and we led the United States and Arizona with 88 new deaths. We also had almost 700 deaths from COVID reported yesterday in the United States, which is one of the biggest numbers in a week or so. I've reported a lot of data from ourworldindata.org, and I'm going to put that link below. But one thing I want to do a little bit different today is I want to start talking about testing rates. It's really hard to get a sense of how many cases there are if you're not aware of how many tests. It's been hard for me to find exactly a website that shows day-to-day tests, so if anyone has that and wants to put that below in the comments, that would help me. On Our World in Data, they report it in tests per 1,000 people, so you can just kind of multiply. So today we had 1.79 tests in the United States per 1,000 people, which works out to about 590,000. I did the math. But I'm going to try to find a better place to track it where you can actually see the number. One thing I've seen a lot of people talk about is there's just been this big explosion in tests. And there has been about a 4-fold increase in tests from April to current. But if you look over the last 30 days when we've seen the cases really take off, there's really only been a 50% increase in our tests. So we went from about 1.2 tests per 1,000 to 1.8. So almost exactly 50% increase in tests over the last 35 days. But during that time, as we've seen about 150% increase in cases. So a 50% increase in tests and 150% increase in cases. And so don't believe people when they tell you that this big explosion we've seen this summer is due to a bunch of extra testing. We have increased our testing, but the amount of cases have outstripped the testing by a 3-to-1 margin. And I'll put links to this data below so you can see it yourself. So let's jump into cases. If you look at cases throughout the world, we hit almost 200,000. 199,771 cases yesterday in the world, which is just a pretty incredible number. If you look at the United States, we already talked about, but we eclipsed 50,000. According to Our World in Data, they actually said yesterday we have 52,000 cases in the United States. The next thing I'd like to look at is death rates. If you look at Our World in Data, you'll see that there was an inflection point in early June, and we've had a slow and subtle rise in death rates in the world. That inflection rate in the United States probably happened more like mid-June. I've reported it here a couple of times, but I'll just say it again. We had an 8-week decline in deaths starting the week of April 17th. We saw 8 weeks in a row where death rates went down, but that changed last week where we actually had a subtle increase in deaths. And if you look at this week, I think we're going to have more than a subtle increase in deaths. You're going to actually see an uptick in deaths that's statistically significant for the first time in 8 or 9 weeks. And so that's something we really want to keep an eye on. A lot of the states around the country went through the same kind of pattern where we shut down in March and April and into May, and then everyone started opening kind of mid-May. And then by mid-June, you're seeing not only cases go up, but now finally death rates. The death rates are going to follow usually 2 to 4 weeks after the increase in cases. And so probably the next 4 weeks are going to be really bad for multiple states around the country. I'm going to put a link below to the Arizona Department of Health website. We had 5,000 cases yesterday, about 3,300 today, 88 deaths yesterday, and 37 deaths today. So the deaths are starting to track up. I'm also going to put a link directly to the hospital bed usage, which is a good thing to look at. We're at 89% capacity for ICU today. So that hasn't really gone up since last week's video. So that's actually pretty good news. I think it's really important that all of us are working together to decrease the burden on hospitals, and we really don't want the ICU percentage to increase any further. So that's kind of a high-level review of testing, cases, and deaths. And then I want to do a couple quick teaching points today. One is I want to talk about the concept of excess deaths. So I'm going to put a link to the CDC website below. Now keep in mind, when you're on the CDC website, their data lags behind like 6 to 8 weeks, but they have a really good section called excess deaths, and you can see the amount of deaths that are predicted in any given week in a year. And I've spent a little bit of time studying this, and what I've been able to find is during the winter, during flu season, we'll get close to 60,000 deaths per week is normal, and then in the summer, it's closer to 50,000 deaths per week. And so it averages out to about 55,000 deaths per week for the last 10 years or so. It's actually very predictable. But ever since the week of March 28th, we've been running significantly above the line with anywhere from 10 to some weeks 22,000 deaths more than what will be predicted. And so I want to kind of talk a little bit today about this concept of excess deaths. There's been 3 or 4 publications. JAMA wrote a good article on it. The New York Times did an article on it. The CDC themselves wrote an article. And so if you look up just the concept of excess deaths, we now have enough data. We're probably 90 days out from this pandemic hitting in the United States, where we can look back and see how many people are truly dying. And what we're finding is there are significantly more dead than even what we're reporting. And so as I look around social media, I see some people, conspiracy theorists, will say, oh, this isn't real and the death rates are way overestimated. But the reality is the death rates are way underestimated. And there's multiple articles and publications on this. But keep in mind, the excess deaths aren't all COVID. There's other things that are killing people more now. We're really clear in the literature that people are dying from a lot of things more this year. Just the fact that we're shutting down is killing people. There was a big article that was published yesterday showing there was a 40% increase in overdoses since COVID. And a lot of that is social isolation and depression and people being alone, and they're taking medications too much and they're overdosing. Not just a little bit, a 40% increase in overdoses. There was an article in JAMA that basically looked at the period of March 1st to about April 25th. And they showed 56,000 deaths from COVID during that time, but 87,000 excess deaths. So that was a 55% increase in deaths, even above what was reported by COVID. So there's 31,000 extra deaths that had nothing to do with COVID. And what they talked about in this article, and I'll put a link to this really good article below, is there's heart disease, for example. People aren't going to the hospital when they're having chest pain. An increase in deaths from stroke, the same thing. They're not going to the hospital. Overdoses, like I talked about. And so one of my teaching points for today is that as we kind of battle COVID being the new normal, it's so important that we get the health care that we need, that we're going to the doctor. If your doctor can see you by telehealth, that's wonderful. That's what I'm doing in our clinics. But if not, and it's important that you go to the hospital if you're having symptoms of chest pain or stroke or something, it's important that all of us are still able to give care to people who need it. So so that's the concept of excess deaths, and I could say more. Well, I did a calculation where there's about 130,000 deaths from COVID now that have been reported, but with 55% increase in excess deaths, even beyond the COVID reporting, that makes the total death toll probably since it started around 200,000 deaths from either COVID or the sequela of COVID, people staying at home and not seeking care. 200,000 deaths, people, in 90 days is a really big deal, and it's super important that we're doing everything we can to fight this pandemic. My second teaching point is deaths aren't everything. And what I mean by that is I've seen some teaching online and even important articles that have said that don't look at cases, don't because cases can be fluctuating based on how much we're testing. Look at death rates as the real example of what's important. But that's not completely true. There's been several articles that have come out over the last couple of weeks talking about the long-term effects of living with COVID. And so one of them that was really interesting, done out of Scripps here in California, showed they looked at the people on the Princess Diamond cruise ship, and they looked at people who had no symptoms, and they did chest CTs and looked at their lungs. And what they found was about 50% of the people who contracted COVID, even if they didn't have symptoms, they still had lung damage, which is pretty scary. And I can just tell you anecdotally, that's kind of what I found. I was pretty sick in New York when I got COVID, but not terribly ill. And I probably showed on one of these videos my pulse ox really dropping. But over the last 90 days, I've found that I continue to have breathing problems. And when I check my pulse ox several times over the last 3 months, my sats have been in the 80s. And so it's been, 2 months now, 2.5 months, and I'm still having symptoms. And so we're seeing that even in people that recover from COVID, they're having long-term damage. There was other research done this week where a lot of autopsies were looked at from patients who had died from COVID, and what they found was massive amounts of brain damage and neurologic damage. And so what we're really kind of worried about in the medical community is what are the long-term effects of people that survive? Are they going to have brain damage? Are they going to have headaches? Are they going to have neurologic issues, lung damage, maybe heart damage and kidney damage as well? So don't get sucked into this line of thinking that deaths are everything, because there's a lot of people that are going to get this and survive. And those people are going to have long-term chronic issues as well. I'm going to do 2 more teaching points and then I'll be done. One is I've had a lot of opportunities to teach about COVID since I got home. And I've been really thankful for that opportunity because I hope that people are listening to me and I'm able to make some differences. One person reached out to me and specifically told me this week that I helped save a life because they listened to my videos and took my advice and quarantined, and then that made a difference by saving some others that they would have exposed otherwise. And so it makes me happy to know I'm making a difference. But a U.S. representative office reached out to me this week to see if I could help with some of their policies and roundtable teachings and community events. And of course, I was very happy to help. But I made the comment that I'm really tired of this being a Republican versus Democrat issue. And anything that I'm involved with, I really want it to be apolitical. I feel like we're wasting so much energy saying, well, look what this governor did, and this Republican governor got it right, and this Democrat got it wrong, or this Democrat got it right, and this Republican got it wrong. And, the analogy I made when I was talking to this U.S. representative office was, during World War II, all Americans pulled together to fight a common enemy, and we won and we were victorious and we came out of it stronger, and we all worked together. It wasn't a Republican issue or a Democrat issue. We all worked together to win the war. And I think for us to make our way out of COVID, we're going to have to do the same thing where we pull together Republicans, Democrats, left, right, whites, blacks, and we fight this together. It's the only way that we're going to be victorious. I'm going to finish with the 4 things that you can do. I know I've taught this several times, but I think it's so important. Maybe you're watching my video for the first time. What are the 4 things that you can do to stay safe and to protect others? Number 1, wear a mask. And wear a mask commensurate with your level of risk. And what I mean by that is if you're a healthcare provider taking care of COVID patients, you need an N95 or even better. You need to have full PPE. And if you're just a young, healthy person out and about, then you can wear a cloth mask. You're still going to decrease the spread of the virus. Number 2, wash your hands and wash them a lot. I like to say 10 to 20 times a day you should be washing your hands. Make your own Purell if you need to. And reach out to me if you want the formula for it. You can basically just mix 70% rubbing alcohol with about 30% aloe vera or even conditioner. Just something to make it not so caustic on your hands. But wash your hands 10 or 20 times a day. Carry your own sanitizer around. Number 3, socially distance, and socially distance commensurate with your level of risk. So if you're 75 or you have comorbidities, just stay at home. You don't need to go out at all. Reach out to loved ones and younger people to take care of you, bring you food order online. But socially distance, commensurate with your level of risk. And finally, this is for businesses, government, for any institutions. We need to be screening people that come into our businesses. We need to test people that come back positive for either symptoms or fevers or whatever. And then we need to trace. Once we find someone has it, we need to trace all their contacts. That doesn't mean every single person they touch. It means people that they have significant contact where they spend a lot of time with them. So screen, test, and trace is the fourth step. Guys, thanks for watching my videos. I really appreciate all the kind words. Feel free to comment below. Anybody, if you disagree with me, it doesn't hurt my feelings. If you've got other data or other ideas, please feel free to put it below. I've learned a lot just from comments over the last couple of months. But thanks for following along. God bless you guys. God bless America.